Hello and welcome to our webinar. I'm Lynn Gresham, former editor-in-chief of Employee Benefit News, and I'll be serving as the moderator today for a discussion on consumer trends that are shaping digital benefit strategy today. As you're all aware, employees have access to a wide and growing number of options to help manage their health. How should employers assess these new trends in healthcare consumerism and shift strategies to account for changing employee preferences? Our panel of industry experts is going to discuss this topic today. Before we begin, I'm going to ask each of them to introduce themselves quickly. Ginny, let's start with you.
Hi, thank you everybody, and thank you for that introduction. I just wanted to share that my title says that I am consulting, but about 2 years ago, I left General Electric after spending about 24 years running their U.S. employee benefits. GE today is a much smaller company, but in its heyday, we were managing about 1.5 million lives and spending about $4 billion a year. So I'd like to be able to share some of my experiences with you today, and I'm happy to be here.
Great, thank you. Dave?
Hi, good afternoon or good morning, depending on where you are. Thank you to Dario Health and EBN for inviting me. I'm Dave Kerrigan, the creator of Benefit Pitch, which as a former benefit consultant, I created to help the swirl of vendor solutions that exist out there, all of the benefit professionals to manage that information. And I'm excited to be part of this panel discussion today.
Omar.
Hi, everybody. I'm Omar Manejwala. I'm a psychiatrist, and I'm the chief medical officer for Dario Health. Super excited to be with you all today. I've been with Dario since March of 2020, and before that, grew a company that developed behavioral health solutions for health plans from startup to over $1 billion valuation on NASDAQ. I'm very passionate about the behavioral drivers of chronic conditions and how we can leverage digital technologies to make the healthcare experience simple, continuous, connected, and effective. Super excited about the conversation today.
Thank you and welcome to you all. A quick note for anyone in the audience with questions today, you can share them at any time in the chat and we'll address them at the end of our discussion. So now let's talk about the changes in the healthcare consumer landscape. What we know for sure is people are changing and employers need to change as well. We want to kick things off with a quick audience poll. Our question is, what digital health trends are you most closely watching? Your answer choices are wearable devices, at-home healthcare and devices, telehealth, digital solutions such as digital therapeutics, AI and digital and virtual solutions, or something else. Which health trends are you most closely watching? We've got a large group today, so it's going to take a few minutes for the answers to populate. Be sure to hit the submit button in the lower right after you've chosen your answer. All right, I think we can close the poll and take a look at those results. By far, it's telehealth. 44% of the audience had that selection marked. Then we had AI and digital and virtual solutions, followed by digital solutions such as digital therapeutics. Thank you all for your participation in that poll. It's interesting to see what trends you're all paying attention to as we start our discussion. So now let's go to our panel. And Ginny, I'm going to put the first question to you. What are some of the biggest changes in consumer behavior that you're seeing impacting employer benefits today?
Thank you. I would say the biggest change that I'm noticing is the adoption of, and the acceptance of digital tools. Prior to the pandemic, telehealth was an experiment. We had put in a program across the country a few years back, and we had sort of a lazy adoption, would be the best way I could describe it. If you brought it to someone's attention, they use it. Now it's just part of people's knowledge base when it comes to healthcare. Can I do a telehealth visit? Telehealth is easy. Telehealth is accessible. And I think that's very exciting. I think that's exciting for accessibility. I think it's an efficient platform, but I also think it's exciting for providers as well, because one of the things that we all desperately know we need is efficiency in the provider system. So I would say that the pandemic helped accelerate acceptance of a very important brand new platform in which, there's lots of possibilities when it comes to engaging employees in a brand new way. I think the only challenge, though, there is with that is making sure that we get the right tools to the right employees. I wouldn't be the first person to say that, people like, Dave and Omar, who have actually started companies and run companies, there is a proliferation of a lot of digital tools out there. And when I talk to employers, they talk about point solutions and digital point solutions. I think the challenge that we all have that employers are now facing is, what are the right tools for my population? How do I make sure that I just don't have tools for tools' sake? How do I get the right people channeled to the right tools? And I think that's the next challenge. Now that we have this new platform, how do we engage people in a way where we know they're going to use the tools? Because just speaking from my experience, tools that don't get used eventually get eliminated because of just necessity, budgets, et cetera, as you can imagine. So I think there's some great opportunity there, but I think there's some new challenges that we all have to face into and find the answers to.
Dave or Omar, did you want to talk about the biggest changes you've seen?
I'll just make a quick comment. I had seen one of those memes on LinkedIn that talked about who is most responsible for the digitization of your organization. And option A was the CEO, option B was the CFO, option C was the CIO, and option D was COVID-19, and it was circled 100 times. And telehealth has been around for ages. Why did it take a pandemic for us to see the adoption? The CIOs and CEOs had the ability to do the digitization of their companies. Why hadn't it happened to this point? So in many ways, the impact that the pandemic has had on this space, I think we're just starting to see that impact, and it's going to be long running and permanent.
Yeah, I would just add that in general, it's been a bad idea to bet against convenience in retail and other types of innovations, and even in healthcare. When things become easier, they become very widely adopted, and moving backwards becomes essentially impossible. So what we saw here, and completely agree with what Ginny, what we saw here was a revolution of convenience, and we're really only just at the very beginning of that.
Great points. Thank you. How can employers account for generational differences in these behaviors? Dave?
I think I read somewhere that this is one of the most diverse workforces that has ever existed. You've got 4 generations, from the baby boomers to the Gen X to Gen Y and Gen Z. And each of these different populations intakes information differently, wants to hear information differently. Some want it fed to us, some want to choose it themselves. And so it produces a increased burden on an already challenging target for employers, which is, how do you roll out benefits that are impactful and then drive engagement in them? And now you've got to account for the generational differences in how they are learning about it. And I think that becomes the focus for what employers need to do. And with their trusted advisors, the brokers and consultants out there, creating the communication channels and the ability for folks to intake the data and information in the way that they want to. To the point, I like the comment you made, Omar, about the convenience side of things. I was with a family this weekend that has, they're a divorced family. There's a new kind of person in the picture who helps out on the weekends. And I learned that they order food on Uber Eats for each of the kids in the family when they do order out. Not one place, but each person gets their own meal. And I'm thinking that's amazing and crazy, but also, to your point, the convenience factor. If an employer has to account for that type of intake of information, how are they going to do this? And I think they need to account for that multi-channel or omni-channel approach. It needs to be on a portal. It needs to be mailed home. It needs to be push text messages. It needs to be on an app. All of these different ways that employers need to account for that multi-generational and omni-channel communication. We're just scraping that surface, and it's going to be ongoing from here.
Employee demand for a better experience isn't new, but the rapid adoption of technology-enabled care during the pandemic certainly did change expectations. How can employers ensure that existing and new solutions will meet these higher expectations to hit engagement goals? Omar?
Oh, sure, yeah. First of all, I'd say the existing solutions that are out there in the ecosystem, and this will be no surprise to the folks that are watching the webinar today, because they're the ones who have been involved in trying to figure this out for themselves. But the existing solutions really are not driving the engagement that's needed to drive improved health and ROI for the employers. And that's really clear. And one of the big challenges for that is that the solutions themselves are largely not consumerized. And so if something's not really built with deep consumer experience, it's generally cumbersome. It's going to be difficult to use. People aren't going to use it. They might sign up. There is this evidence that if you bombard folks with materials, they may sign up, but they'll quickly see that it's not convenient. I mean, people are smart. They'll see it's not convenient. They'll see that other things in their lives are more important to them. It's not personalized to them, and they won't continue. And so that's why right now, when you look at just such a wide range of surveys of folks in benefits, that so many employers are really planning to change who they're using this year and ditch some of the current contracts they have in place to move on to others. So we're seeing a lot of that kind of change and signaling of that kind of change, because they're not getting the results that they want. Now, on the other hand, solutions that do have some real experience in the direct-to-consumer space, retail, focus on simplicity and convenience, focus on ease of use, focus on the things that are important to folks. Those are really getting some wildfire-like adoption, and we're also seeing that solutions, because there's so much consolidation here, that we're seeing some solutions that are covering multiple conditions. They're better able to handle kind of the fundamental truism when it comes to engagement. And that truism is that people will engage in things that are relevant to them, that are quickly effective, and that are easy to use. And so, at Dario, we say that what matters to people is generally far more important than what's the matter with folks. So we see a lot more consolidation for sure. We're seeing more focus on digital front door. That's great. But remember that if you present a front door that is integrated, you still have to integrate the rest of the house so that all the conditions and data are talking to each other. And that's where we've been going for a few years now at Dario as well. So I think, to answer I think it's a great question. And, I think it comes down to employers really looking for three things. First, a direct-to-consumer experience, real experience with consumerized solutions, clear experience with engagement, and demonstrable evidence of that. Clear evidence of, number two would be clear evidence of efficacy and ease of use, and prove to me that it's simple. And then third, I would say solutions that cover in a unified way, in a unified kind of experience, the major issues that employees are facing, and that employers want to solve. So I think if you wrap all that together, you can see that that's the path that it seems, based on surveys, based on us talking to folks, and also based on purchasing habits, where employers are really moving to hit those engagement goals. Yeah.
Ginny and Dave,
And
your
Omar,
thoughts on hitting goals?
actually, Ginny, go ahead. I was going to comment, but I want to hear your comment first.
Yeah, I mean, Omar, you talk about consolidation and integration. I think those are very important ideas. Employees want to use the tools that employers have. It's part of the perks of the job. The issue is that in the benefits area, particularly in the health benefits area, they're not always top of mind. So you can have a great cancer COE or orthopedic program, but you're not thinking about having back pain. You're not thinking about coming down with cancer. You're not thinking about necessarily having a baby. When the crisis hits is when the information has to be available. And so employers who think strategically about this, who can come with like an integrated front door that tells people, listen, anything related to health, go through this door and we'll get you where you need to go. And that sounds very easy, but it's very complex. I think that's where you're going to get successful engagement. A laundry list of tools, and we've all been guilty. I've run programs that have had this, is just that, a laundry list of tools, and it's a hit or miss game whether employees, bounce in and out of these tools. So I think you're right, spot on when you talk about integration, either concierge or direction. That's absolutely necessary in today's world.
And I was going to piggyback. I had a feeling you were going to go that direction, Jenny, and I'm so glad you did. And to Omar's point, when you said that Dario is more concerned about, I forget how you framed it exactly, but not what's happening to you, but what's important to you, this almost brings in the front door before the front door, which is almost like the employee resource group where you're talking to your employees about what matters to them. Yes, there are health concerns, and the data and the claims will bear that forth, and you'll know what programs you need to put in place, but what else? What else do the employees want or want to see the organization put in place? How are you intaking that information into your benefit decision-making process? Creating the front door, the navigation, I think is the word in some cases we're looking for, to the right resources when you need to consume them. And I think that the multi-generational aspect of what you see in the workforce, you're going to see more and more emphasis and focus on what those employees want, and then how the employer then threads that needle to get to the right tools, the navigation to those right tools.
Great. Thank you all for those comments. Staying on the topic of engagement, we've got another audience poll. As you think about the omni-channel solutions for your employees, how would you like to see people being engaged? Would it be digitally with an app or device, telephonically, virtually, or with a coach? What do you think the best way is for people to be engaged?
Does anybody else hear the Jeopardy theme song in their head playing while we're waiting?
We should have some music. You're right. We'll give it a few more seconds. Thank you all for your participation. All right, let's close the poll and take a look at what we have for our results. Digitally with an app or device came in at 45%, followed by with a coach at 35%, and virtually had 20%. Nobody chose telephonically. Panel, do those results surprise you?
I almost want to say,
yeah, go ahead.
Go ahead, Omar, please.
Well, I was not at all. I think we were and this is good because we were intentionally unfair with this question, because the right answer ultimately is that it may change over time and with my circumstances, and it has to really be personalized and adaptive. In general, though, don't bother me on the don't bother me on the phone. I mean, there's some people who do want to be, but I think really adapting the channel to the context is the right way to look at this. Yeah.
I was going to ask the results of the prior poll. Wasn't there a telephonic option that was very high? And isn't it interesting that it's non-existent in this one?
Yeah.
I was going to say the correct answer is it depends, right? Depending on the population, depending on the moment in time for that organization. So yeah, definitely a trap question, Omar, right?
Well, maybe it was answered in this vein. As a benefits manager, I'd like to see people operate digitally, so I don't have to have 1-800 call lines and customer service and some of the other channels of communication that I've had to keep going while the digital solutions are being applied. But I think the reality is what both Omar and Dave are saying is it just depends on the population as to where they're going to naturally go or gravitate to.
Ginny, I'll put the next question to you to start with. In today's economy, how should employers think about evaluating new benefit options to meet employee preferences and also support business goals?
Well, nothing like a looming recession, stock market liability, company splitting up and laying off people environment to get you thinking about costs if you're in the benefits world, as you all know. It's a tough environment right now. I think and we all lived it during the pandemic, focused on, getting people engaged, information they needed, stay connected. Costs weren't necessarily part of the equation. Matter of fact, covering lots of stuff at 100% to make sure people got the care that they needed and there weren't access issues. And we talked about telehealth and how important that became. Things are shifting. You can't listen or read a headline about a big corporation where there's some major changes, either layoffs or inflation. And medical inflation is starting to tick up with the rest of other goods and services that we consume in the United States. So it is a very challenging time. But if you break it down and you look at each of the products and services you have and with 3 pillars, how satisfied is my population with what I have? What is the quality, or as Omar said, the efficacy of what I am using? And what is the cost? I mean, the reality is we'd all love to do everything for everybody, but cost has got to be part of the equation. And that's why getting actual demonstrations of how effective these products are is going to be very important in the next sales cycle, I believe, for employers, because there will be pressures on them. Their leadership is not coming to them today saying, come up with a solution to engage people. They're saying, okay, well, how do we make sure that we right size this budget? How do we justify the fact that we've laid off 5,000 people, but you want to add new programs? I mean, these are the conversations that are going on in the back room. I think cost is always there, but that we're going to have a great emphasis in the next year. And it's going to be a challenge for anybody who sold an employer a point solution during COVID to step up now and to show that it is effective and something worthwhile having. And I don't know, Dave, how you feel about this, or Omar, since you work with employers on a day-to-day basis, but that's my read.
Omar,
go ahead, Dave. Yeah.
No, please.
Partners are going to be held accountable, and they should be. I mean, we should be held accountable. We should deliver reports on the indicators that matter, on things related to, our outcomes. And I think that it's just spot on. We're going to be measured in those 3 areas that you laid out, and we should be.
I think an added complexity to this, Ginny and Omar and Lynn, is that a year and a half ago, you had this situation where folks were not back to work, but employers were ready to ramp up. And so they were offering more rich benefits to get people back to work. And then the pendulum has swung completely to the other side, where now you've got the right sizing and downsizing and layoffs and things of that sort, which might make you think that, the employers are back in the driver's seat of offering a certain amount of benefits. And not that it's take what we have, too bad if you don't like it. Not that an employer would ever take that sort of an approach, but I had attended an event where there was a survey that had been done by one of the companies that said that the amount of folks who are still leaving organizations, the turnover is still maybe not as high as it was a year ago, but it certainly hasn't quite gone to what you might think, considering the current economic condition with lots of layoffs, meaning more people looking for jobs. Folks are still leaving those jobs. And, they don't mind that there's not another job on the horizon right now. Somehow they're able to survive that. Now the employer doesn't necessarily have the freedom or liberty to say, this is what we're going to scale back to, because from a cost standpoint, this is what we can afford. They still need to account for the loyalty, attraction, and retention side and still offer very rich benefits to attract and retain those people. And it's a real, challenge for employers to balance that dichotomy.
So here's something that I think is interesting. I think it's been a long time since somebody has done a study as to whether or not benefits actually are a retention tool in the workplace. And we could debate this. It's a topic probably for another call. But I think we underestimate other areas of support that employers are looking for other than, is it going to cover my PCP visit? And I think we've got to think bigger. Sometimes we make the mistake of throwing money into those buckets, but not throwing money into training supervisors to communicate better with employees, or, what's a 4-day work week look like? So you said it, both of you said it, the world is changing. And so some of the conventional solutions to employee retention aren't going to make it. I have a son who's a millennial. I'll admit that. And he took a break from his job. His parents would have never done that. He had 2 young children. He took a break from his job. He saved up to do this, and he sorted things out, and he took a new career path. This generation has, I give, at first I was horrified, but now I applaud him for that courage. But that's what you're dealing with. And it wasn't because of the dental benefits or the vision benefits that he wanted to stay or leave or went to his new opportunity. There's more going on, and we have to recognize that. And, it's going to take some time for us employers to get our heads around that, I think.
Great points. Thank you. Do you think we'll see less investment in point solutions? Dave, would you start?
Sure, happy to. I think that there's 2 forms of investment we're talking about. One is the employer who chooses to add benefits, which flows very nicely into what we just had a conversation about. You might think that they might scale back considering the economic climate, but instead they still need to offer rich benefits that help with attraction and retention. And again, Ginny, assuming that benefits actually help attract and retain. I happen to think they do in many cases. The other side of that, of course, is kind of on that point solution side, which how many digital solutions have you seen enter the market in the last 5, 6, 7 years? The dollars that have been put in are in the billions with a B. And that includes HR technology, investments in that space, billions with a B, digital health, billions with a B, and InsurTech, which could be systems for quoting and things like that. All of them have had billion-dollar investments over the last X number of years, and that's billions each year. Now, with that in mind, there's a lot of new solutions. Now there's an economic climate that's changing. What do you think will happen? And I'm hearing that a number of VCs and investors that I'm aware of and have relationships with, a lot of them are saving what they call their dry powder. So any dollars left in their fund, they're saving it for follow-on investments for their current portfolio companies, not in new solutions. So that's to say, if you have investments, you could potentially count on a follow-up investment from your VC firms. But if you're a new entity starting out looking to raise money, it's going to be a harder slog of it trying to raise that capital to get into this space. So I think that you're going to see a shift occur where some are going to partner, some point solutions that are touching the same space but in different ways are going to see that they're better together, and they're going to start to form some alliances so that an employer doesn't have to choose between one or two or three solutions. They're choosing kind of a joint solution paired together by maybe two entities. And I think that the other play that you might see here is if an employer can't find extra cash to invest in new solutions, then how does a point solution get to market? I think you're going to see more focus on kind of them doubling down on the number of lives. Employers can move faster than health plans, generally speaking, but I think you're going to see some of these solutions look at health plan partnerships to get access to a broad group of people in a health plan where you can get hundreds of thousands of lives with a deal, versus employers and brokers. If you're going that route, they can be 1,000 employers at a time, 5,000 at a time. So I think you're going to see that shift to the partnerships and to focusing on health plan relationships.
Omar, what would you add to that?
Yeah, so look, the fundamental problem is engagement for sure, and we know that. I mean, that's been what we've been chasing for many years here, and ultimately, the point solution compounds the engagement problem. Because I'm not a point. I have many issues that I need to have addressed, and don't make me do 40 different things in order to get those solved. And so, and from an employer perspective, and also from a health plan perspective, having to partner with 20, 30, 40, in some cases 200, different solutions, that's hard for employers. Imagine how hard it is for people to engage in. And even if you integrate the front door, it's still hard because the back end is not integrated. So what's going on with my diabetes doesn't talk to what's going on with my high blood pressure. We all know my pain impacts my depression, but those parts of my solution don't talk to each other. And so it just becomes super hard, and I drop out and I don't engage. So I think we're seeing, I definitely agree with what Dave has said in terms of what the venture folks are doing. We're seeing a shift from growth at all costs to kind of smarter, efficient growth focus, but we're seeing consolidation. And look, we've been a part of it. We bought 3 companies in the last couple of years. So we certainly think that consolidation, integration, these are going to be some of the answers. But at the end of the day, I think that the proliferation of point solutions has kind of done nobody any favors here. And it's going to have to be dialed back, and it will be dialed back. And this is part of the reason that we're seeing a lot of these RFPs coming out, and a lot of folks looking at trying to kill more birds with one stone, kind of more whole health kind of approach out there. But I think it's a real challenge, because what do? You've got, in some cases, you've got some niche conditions too that really need to be solved by, and that's the real good use of a point solution, is for some niche or narrowly defined area that doesn't tend to overlap. But for most conditions that tend to overlap and interact with each other, or problems that tend to co-occur in the same person, those solutions should probably be integrated. Yeah.
You know, Omar, you say something important. You know, we've all been through the cycle: innovation, consolidation, integration, consolidation, HMOs, large health plans. I mean, we can talk about managed care, now the world as we know it. So we're gone through another cycle. And I agree with you. I think the next opportunity is in the areas that will be sensitive to cost. So for example, infertility benefits. There are no point solutions that I know of that are effective at managing the costs around infertility benefits. They're all searching for that. So there will be some opportunities, but it's going to be very specific, very pointed kinds of stuff that we're taking all the learnings from this last couple of years of investing billions of dollars into point solutions so that we can pull it forward in a way that will be more effective to catch the next wave, because there's always going to be one out there.
Yeah, and speaking of that next wave, I really like that point, because I think that, we'll see economic growth, we'll see contraction, we'll see tech layoffs, we'll see hiring, we'll see a solution to this hybrid, multiple solutions to this question of hybrid work. We can't predict what's going to happen in the future. We've got global war. But one trend doesn't seem to go in the backwards direction, which is people in America are getting sicker, more overweight, less mobile, and it's more costly. So all of these macro environmental factors are occurring in the context of a problem that is marching towards worse. And so that's really where there's an opportunity to get ahead here. Dave, I'm sorry, I think I stepped on you there.
No, I'm joking. I was going to say that by the end of this webinar, I swear Omar and I will stop stepping on each other's toes, but I don't think it's going to happen. We're just going to continue to do it, which is
Cheers.
fine. We're two or three, passionate panelists with Lynn moderating. Like, we got a lot to share, and we're excited to share it. I think that it's really interesting. All of the things we just talked about, if you're not measuring your point solutions in the front end to do what it is you want it to do, yes, your employees need something, want something. Maybe you've got your employee resource group and you've listened to them and you're starting to look at that. But if you're not holding the vendors and the solutions to task, this really interesting relationship occurs where the employees now can't live without a particular solution. And if there's a better solution on the market that maybe drives better outcomes, lower costs, what does that employer do? Is there the ability to partner between those? Very rarely. But now you're saying, oh, there's a better solution. Should we swap it out? Oh, the disruption to our population. What are they going to say about it? And it really creates this vicious loop where you might get stuck with a benefit where, to the point you made about fertility, a lot of fertility benefits are similar to other, call it hospital consumer economics, which is it's fee for service. When 3 tests are ordered, 3 tests are issued and paid for. And the individual doesn't pay for those, the health plan does. And if it's a self-funded employer, the employer's paying for it. So what if there were another solution that was less costly for fertility? Would it jive nicely with the existing fertility vendor? Not necessarily. And then the employer's in a position where, should we swap it out? Should we add both? Do we just say, leave it alone and wait to the next cycle? It's a really interesting thing. And I think it starts with the front end evaluation of what are you looking for from this vendor? Are you holding it to task? And regular evaluation of the solutions you have. And if they aren't hitting whatever those metrics are, and Ginny, you went through a list of them, if they're not hitting those, there's either performance guarantees, contract outs, penalties, whatever the case might be. But I think employers and their broker partners need to become more active in this process.
Those are all great points. Thank you. Where do you think employers, I'm sorry, Ginny, did you want to add something? Oh, sorry. Where do you think employers can focus for meaningful wins today when it comes to delivering those benefits that consumers want while still meeting their business goals? Omar, would you take a stab at that one?
Yeah, sure. So that's always the challenge, right? How do I meet the employer and the consumer goals? I think, better health is a win for both. So, but only if it can be delivered efficiently. So we've seen, as we look at the competitive landscape, at Dario, we've seen a lot of solutions that are really just digital platforms for human coaching, and little more than that. They just basically paved the path. And that's really hard to scale, and it drives up cost, and often people don't want to use it. Just like your point about the telephone, the poll that we had about the telephone, which is, you have to give folks something that's efficient and effective for them, and that's scalable ultimately if you're going to deliver that cost outcome, especially that Ginny was talking about there. So I think we focus on basically 3 criteria that help us meet both the consumer and the business objectives. It's a little easier for us to do because we began in the direct-to-consumer space, and we're still in the direct-to-consumer space, and we use our direct-to-consumer channel as an innovation laboratory. And that direct-to-consumer capability also helps us with the various markets, including, like, say, the small group market and other markets. So because we're close to the consumer, we have the capability to solve that area. But we focus on 3 criteria to meet both the consumer and the business objectives. Number 1, is this a condition that's behaviorally driven? In other words, if I change 50 or 100 things that I do, will this condition get better? And that's the first question. And then the second is this condition expensive? In other words, if we improved it, if we made it better, would it reduce the need for things like expensive emergency room visits and third tier pharma and inpatient hospitalization, things like that? So that's the second. And then the third is the condition prevalent and problematic? Are there enough people that have this that it's worth going after, and that it's causing problems that are going to the to the employer level as well? So when it comes to those criteria, we're also seeing, and Dave talked about this before too, we're seeing this problem of the point solutions and the vendor complexity. And if I have to partner with 5 different companies to solve this, that eats up the ROI. There are a lot of unallocated potentially costs that it can affect. It eats up the engagement since people don't want to use all those different things. And so that creates a problem too. And then we also see integration problems where solutions can't integrate their data layers. They don't integrate clinically. They don't interface with the existing ecosystems. Now they all, I've seen the answers to the RFPs. They all say that they're going to do this and that they're capable of doing it. But when you look under the hood, they haven't really built the infrastructure. A lot of these companies are, venture backed and aren't really capitalized for or really rewarded for this type of integration. And so that's another problem there too that you see. We see problems with engagement, problems with vendor reporting, friction with employees finding the solutions aren't really consumerized. We see a failure to secure clinical outcomes. If I'm using you for a solution for diabetes, then show me that you've improved the diabetes. Like, show me that the HbA1c has come down. Show me that people have lost weight. Show me that, chronic pain is, let's do quantifiable outcomes here that people are held accountable to, as Dave mentioned earlier, that we're actually at risk for. And so then, back to your question, Lynn, I think achieving that sort of dual aim of happy consumers, employees, and a business ROI as well. It means delivering solutions that people really love, solutions that actually work for them, solutions that address the things that matter to them, but that do so efficiently using technology so that they can get the right returns and really leveraging the scale, the technology and the platforms for scale. And that's not what you're seeing with the first generation digital solutions out there that are really just paving the cow path in terms of deploying coaching in a digital kind of platform without optimizing, who does best with coaching at what time, who wants self-service tools and when are they the right, optimizing that mix and using technology for the real power that technology could bring to the table here with digital interventions. And I think that's the real promise of technology and AI, to solve that kind of dual aim, to dynamically personalize interventions, to drive health, but also to drive ROI in a highly engaged, consumerized kind of way that improves health and ultimately lowers the cost of care. And so that's the promise of technology. And I think we're just starting to see it because the first wave of solutions didn't really take us there. Yeah.
Dave, what would you add to that?
You can tell I'm just chomping at the bit. I think that it's so interesting that a direct-to-consumer solution, so many of them want to pivot into the employee benefit space because it's more that one-to-many to drive, growth and revenue faster, whereas direct-to-consumer requires a lot of upfront marketing to get that word out. And yet the engagement for direct-to-consumer tends to be higher. And you say, well, why is that the case? Oftentimes it's because the person, the individual, opted into it. So if I select something, if I buy something, I'm probably going to use it more than something that's offered to me and I don't know if I need it or not, or I maybe didn't know I needed it. So when an employer offers something, I'm kind of shrugging my shoulders going, that's interesting. Is that for me? I don't know. Maybe it is. And it actually creates this interesting opportunity that I think we're seeing in the space today. So when we're talking about trends, it's this combination of what Omar said about focusing on the impactful areas while still providing the option for choice. So what if an employer is offering key benefits for those high cost drivers, and then offers lifestyle spending accounts for the other items. So if if it's not a high cost item or something that can be impacted, can it be offered in a way that an employee can take dollars from an employer and opt in and buy it themselves? All sorts of challenges with that, because there's the navigation side of, there's a big marketplace of solutions and which one should I choose? And there's 3 different ones. How do I tell which one's right for me? But I think on its surface, there's promise here that allows that combination of technology, consumer choice, and opting in, which would drive higher engagement. And of course, provide more variety for an employer to offer the benefits that their employees want and need.
And I might add just one. No, sorry, go ahead. Yeah.
No. Omar, go right ahead.
Well, I was just going to, as a almost an additional punctuation to Dave's point here, the majority of solutions that are going after employers right now have no direct-to-consumer background. And I completely agree with you about those that do. But the majority have none whatsoever, and they've tried to skip that. And part of the reason is the one-to-many. And the other part of the reason is they have concluded that it's a lot, and I know I may sound glib when I say this, but they've concluded that it's easier to convince employers to pay for solutions than it is to convince people to use them. And I think that's been very dangerous, and it's poisoned the well in a lot of ways, where we've seen solutions now that are failing, and there's been a tendency to say, okay, can you really engage? And so I think the burden is on us, those that have the experience in the direct-to-consumer space, to say, this is why easy, simple, engaging solutions are, with Pivot, are capable of driving the engagement that's needed. Yeah.
Ginny, any last thoughts on that?
No, they're all great points. And I know we're sort of running low on time and we wanted to take some questions. The only thing I'll say is, one of the reasons why I believe the employer world is so enticing is that's where the major innovations in healthcare, although they may not be large enough innovations to solve our problem, have come from over the past 2 to 3 to 4 decades. So, people are following that path. And, as I said before, one of the things that I wish would happen is a little more adoption in the provider space, because I feel like as long as we're, working at this level with employees, we're not getting down to the root causes. But, that's a topic for another call, I guess.
Okay. Well, let's turn to some of the audience questions now. One of our listeners says, I would appreciate hearing about some hard quants on results that prove performance. Omar?
Yeah, sure. So on our side, we've got a number of key proof points. We think about proof points in 3 areas. One is on consumer engagement, the second is on clinical outcomes, and the third is on partnership-related outcomes. So on the engagement side, you can open up your phone and go to the Apple App Store or Android. I think we've got 20,000 plus reviews, 4.9 out of 5 stars. So the strongest endorsement is just the fact that people love using it. And then on the clinical side, we've got, I think as of today, 37 or 38 clinical studies, large studies, rigorous studies. We have multi-year outcome studies on improvements in diabetes, hypertension, MSK, behavioral health, and we can share all of that with you. And then on the partnership side, we are very specific in our contracting language around where we put fees at risk and in contracting in a value-based way. So I think it's a good point. When folks come to the table to have these conversations, there have to be very clear definitions of engagement and enrollment, clear definitions of the numerators and denominators, clear consequences for not performing, and opportunities if we exceed objectives, solid clinical evidence that meets the rigor that are needed, and evidence of engagement capability, evidence that your solution is well loved. And all of these things should be independently verifiable. We shouldn't take our word for it. And so then I think it's important for third-party validation of outcomes as well. Yeah.
Anyone else want to comment on that? Okay, the next question is, even when we offer a benefit that our employees are asking for, it's hard to get people to engage. How can we make sure we're offering solutions that people will actually use? Ginny,
Can
you
I
wanna
actually
start?
ask a question? Yeah, I was going to ask a question almost back to that panelist, not the panelist, the attendee, and then to Ginny as the resident kind of employer expert. I always have this question around, Omar, you said when a solution fails, and I'm wondering, did the solution fail or did the communication around the solution and what it can do fail? So not enough people engaged, and therefore the ROI that could have been wasn't met. And so there's a question I have around, as an employer, how do you let the point solutions engage and communicate? Do you allow text messages? Do you allow mailers at home? Do you allow emails? And of course, as an employer, thinking about managing that for a large, number of employees, you're going, I can't have vendors go hog wild with communications to my people. There'll be an uprising against me. And so I guess back to you, Ginny, is like, how do you manage the communications to allow the balance of reaching the employees without overdoing it from a communication standpoint?
Right. I think you have to, all good points. You have to run your benefits almost like a marketing function these days. There is a clear correlation to promoting the benefit and utilization. People who have measured this in their programs will see it time and time again. It's not good enough during annual enrollment to say we have this program, go ahead and use it, and then revisit it the following September and say, wow, nobody used it. It must be a failure of the program. In signing on to these products, you also have to sign on to what is the plan to engage. Now, certain employers have their quirks. We don't want to release emails, et cetera. I think we have to challenge those internally. If it is an important enough program to say, some of the privacy issues that we've had as employers, are they still the right types of policies for today's environment? Or were they written when there weren't digital tools? And so how do we work with them without obviously sharing too much or bugging employees too much? And there are ways to do it. I'm a big fan of piloting. I'm a big fan of engaging with employees, calling them in, trying something with a group. If you have the luxury of having a contained group somewhere in your population, to talk to them about this, what do you think would work? Instead of just sitting in your office and coming up with what you think the right solutions are, some of the answers are right there in the employees' heads, and we might as well go and search them out. So not an easy task, but communication and making sure that you've challenged some of the old guard principles of what was permitted and prohibited, et cetera, I think it's the time to do that in order to get the right level of engagement in these products.
Love that response. The challenging of the norm, I think that needs to happen more. And I love that you said that.
Talking about generating engagement with digital health benefits, what do you think is more important, traffic or personalization?
Could be a chicken and an egg, right? Without personalization, do you get the traffic? I think that back to the consumers in the workforce, those different generations, if you're not reaching them in the mode in which they want to be reached, you won't generate traffic, period. And so understanding what your employees want and how they want it, and then meeting them with that modality will then lead to the traffic. So if that's a chicken and an egg, I'm personalization first, traffic second.
And I would agree with that. I just as a thought experiment here, I've opened my Outlook email, and I see that I have 5,242 emails in my junk unread. And those are filtered. So at the end of the day, I think it's got to be relevant to me. Then it gets a chance. And then the question is, can it be delivered in a way that is personalized? And when we say personalized, what do we mean? We mean the timing, the tone, what channel it's coming to, the frequency, the particular intervention that's recommended. All those factors need to be considered when we're personalizing. And by the way, I'll just say for the record, the majority of digital health solutions are not personalizing their communications across those dimensions. And we certainly see that with first generation. So the next generation really needs to, I think, deploy that personalization to achieve that objective that Dave is talking about.
This
I
question
think there's
is for
one.
Ginny. Ginny?
Yeah, the only thing I'll say is I've sat in so many vendor presentations where they've said to us, you know, we've had 90% of this population sign up, or we've had this level of traffic, or, you know, we have this level of engagement. The question is, what are employees doing with the information you're sharing with them? So unfortunately, to do this right, you got to take it to the next level to say, how many employees actually followed the recommendations, or how many of the employees actually, you know, did the 90-day plan or whatever. And that's where it gets harder, but that's where it's more rewarding once you take that extra step. And you'd have to involve employees, I believe, to measure some of that results. And that's, you know, some of the challenges. But, you know, the fact that 90% of a population have signed up for an app, you know, doesn't mean very much, as we've now come to learn. 3 years ago, we believed that was important, but now we're like, okay, now what? So we're learning every step of the way.
Ginny,
Very
is
well said.
passive enrollment part of the problem now that voluntary benefits tend not to be set aside from the core plan?
You know, it goes back to people want to engage in what they want to engage to, you know, with. And so I'm not sure. I think it depends on your population if that's part of the problem, but I think you got to treat employees like adults. I think you got to clearly and simply explain what's out there for them. Hopefully you've selected a menu that has gathered has some relevance to their interest levels. It's not a blind selection. And then you have to evaluate and get feedback from them about it. So, you know, I'm not sure that there's one piece of the puzzle that's the issue. I think all of it needs to be worked. And, you know, some of the traditional benefit organizations aren't set up to do that. And so we've got to figure out ways to get sort of a marketing or a digital scientific mind into the HR benefits track so that they can think like this versus, you know, how do I negotiate with Anthem, or how do, you know, that's important too, but now let's add some different skills to the team is what I would suggest.
Well, unfortunately, we are going to have to leave our discussion there because we're out of time. If we didn't get to your question, Dario will follow up with you offline. Thank you all for joining us today for our webcast. I'd especially like to thank Ginny, Omar, and Dave for taking the time to be with us and for sharing their considerable expertise. And a special thank you to Dario for sponsoring the event. If you missed any part of the presentation, you'll be able to hear a recorded version within 48 hours on the EBN website, and we will send you an email with a link to that recording. Thanks again for being with us, and have a great